Anxiety and stress disorders are among the most common mental health conditions that affect individuals across the world. These disorders can significantly impair a person's quality of life by interfering with their ability to function effectively in personal, social, and occupational settings. Although experiencing stress or anxiety is a natural part of life, particularly in response to challenging or threatening situations, anxiety and stress disorders involve excessive, prolonged, and sometimes irrational fear or worry that does not match the actual threat posed by the situation. Understanding the nature of these disorders is essential for mental health and wellness practitioners to support individuals on their path to recovery. Anxiety is characterized by a persistent and overwhelming sense of fear, worry, or nervousness. It can manifest cognitively, emotionally, and physically, often without a specific or identifiable trigger. The core issue in anxiety disorders is not the presence of fear itself, but the intensity and duration of the fear response, which can be debilitating. For example, individuals may experience panic attacks, shortness of breath, dizziness, or a racing heartbeat in situations where there is no immediate danger. These physical symptoms are the result of the body's fight or flight response being activated unnecessarily or excessively. There are several types of anxiety disorders, each with unique features. Generalized anxiety disorder is marked by chronic and exaggerated worry about everyday life, including responsibilities, health, or social interactions. Panic disorder involves sudden and repeated episodes of intense fear, known as panic attacks, which can occur unpredictably. Social anxiety disorder involves an intense fear of being judged or embarrassed in social or performance situations, often leading to avoidance behavior. Specific phobias involve an irrational fear of certain objects or situations, such as heights, animals, or enclosed spaces, which leads to intense distress when encountered. Stress disorders are closely linked to anxiety and often arise from exposure to traumatic or overwhelming life experiences. Acute stress disorder may occur shortly after a traumatic event and can involve symptoms such as dissociation, intrusive memories, and heightened arousal. If these symptoms persist for an extended period, the individual may be diagnosed with post-traumatic stress disorder. This condition includes flashbacks, avoidance of trauma stimuli, emotional numbing, and heightened vigilance. Stress disorders not only affect emotional well-being but can also have long-term physical health consequences if left unaddressed. The causes of anxiety and stress disorders are multifactorial and include genetic vulnerability, brain chemistry, personality traits, and life experiences. For example, individuals who have experienced abuse, neglect, or prolonged exposure to stressful environments may be more susceptible. Additionally, certain medical conditions and medications can contribute to the development or worsening of anxiety symptoms. It is important to understand these underlying causes to tailor appropriate interventions for each individual, as there is no single cause or solution that fits all cases. Symptoms of anxiety and stress disorders often include both psychological and physiological components. Emotionally, individuals may feel apprehensive, irritable, or constantly on edge. Cognitively, they may have difficulty concentrating, experience racing thoughts, or find it hard to make decisions. Physically, symptoms may include tension, headaches, gastrointestinal discomfort, rapid heartbeat, or fatigue. These symptoms can be distressing and can lead to secondary problems such as sleep disturbances, relationship strain, and reduced performance at school or work. Effective interventions for anxiety and stress disorders begin with a comprehensive assessment to identify the specific nature and severity of the condition. Psychological therapies are among the most effective approaches. Cognitive behavioral therapy, for example, focuses on identifying and changing unhelpful thought patterns and behaviors that contribute to anxiety. Exposure-based techniques are often used to help individuals gradually confront and reduce fear responses to specific stimuli. Additionally, skills such as relaxation training, breathing exercises, and mindfulness practices can help individuals regulate their physiological arousal and reduce the impact of stress. Building strong coping mechanisms is a crucial part of treatment. Practitioners can assist individuals in developing problem-solving skills, time management strategies, and emotional regulation techniques. Encouraging healthy lifestyle habits such as regular physical activity, balanced nutrition, and sufficient sleep also supports the reduction of anxiety symptoms. Social support is another vital component. Encouraging individuals to maintain meaningful relationships, participate in community activities, or join support groups can reduce feelings of isolation and increase resilience. In some cases, collaboration with other healthcare professionals may be necessary, especially if anxiety symptoms are linked to physical health conditions or if they persist despite initial interventions. It is important to adopt a holistic and integrative approach that considers the individual's entire well-being, including emotional, physical, and social aspects. Coordinated care allows for more effective treatment planning and ensures that the individual receives the most appropriate and comprehensive support. Anxiety and stress disorders are highly treatable, especially when identified early and managed with a well-rounded, empathic approach. As mental health and wellness practitioners, it is important to recognize the signs of these conditions, understand the impact they can have on daily life, and apply evidence-informed strategies to support individuals in their recovery journey. Creating a safe, supportive environment where individuals feel heard, respected, and empowered to face their fears is key to helping them regain control over their lives and achieve a greater sense of peace and well-being.